Breaking news off the top at 11, we are learning about several cases of coronavirus in northern Michigan tonight, including at Munson Hospital in Traverse City. Munson actually confirmed cases at two of its healthcare facilities, Munson Medical Center in Traverse City with a patient from Leelanau County and Munson Healthcare at Otsego Memorial Hospital in Gaylord. There is also a woman from Charlevoix County with the virus, but she is being treated downstate. Montcalm County just declared a local state of emergency after a case was confirmed there. We rushed 9 and 10's Bill Freilich to Munson Medical Center in Traverse City to get the latest. Bill, what's going on?
Good evening, guys. We are live on the Munson Medical Center campus. I'm Bill Freilich, and I'm joined by Dr. Christine Nefsey. She is the Chief Medical Officer with Munson Healthcare. Thank you so much for joining us. We just wanted to give the opportunity to explain to the viewers and the public what's been going on lately, and obviously this has been a busy couple of days for you, and especially last, few hours, to say the least, too. So in the interest of our own social distancing, I'm going to share this microphone with you and just kind of pass it to you across the table, and she'll be answering some questions for us here as we get going here tonight. First of all, what can you tell us about when this was, when these tests were done and when this was identified for Munson?
Well, we were notified by the Michigan Department of Health and Human Services this evening that we had two patients in our northern Michigan community who tested positive for COVID-19. One of those patients was tested at Munson Medical Center in Traverse City, and the other patient was tested at Munson Healthcare Otsego Memorial Hospital in Gaylord.
And what can you tell us or not tell us about whether these are Traverse City residents and Gaylord residents, and what, obviously there's only so much you can say.
There's only so much I can say. We do try to protect the privacy of our patients, and that's really all the information I have at this time.
Okay. In terms of the testing, I know that has traditionally taken a couple of days as well. This wasn't something where these individuals were tested this morning, for example?
No, it would be nice if we had that quick of turnaround, but we are not quite there yet with the state lab.
Okay. So what happens from here as far as the Munson staff goes? You had indicated in the announcement earlier that there's precautions that are taken, and also identifying which staff members were in contact.
Absolutely. Many of our colleagues downstate already have had COVID-19 positive patients, and we have a pandemic response plan. So we at Munson Healthcare have been preparing for a couple of weeks now for this event. So all of our staff and employees were wearing personal protective equipment. So we're not concerned at all that those patients that were cared for in our facilities spread it to our employees.
So no change in staffing in terms of would those individuals be taken off of duty or anything like that?
No, we actually have a plan in place to already screen our employees as they come in. So they were all wearing their personal protective equipment. They should be at no higher risk.
Okay. Is this a question, my next question, is it a question more for Munson or for the State Department of Health in terms of where these individuals may have been, who they may have been in touch with, in contact with, and obviously, especially then in the last few days since they were tested, where have they been since then?
Right. So we have an obligation, obviously, to take care of our staff and our patients as they come into our hospitals, which is why we've limited visitation and those kinds of things. We'll work very closely with our colleagues at the health departments to make sure that they track any other exposure that might have happened in the communities. And
I guess, does this change anything in terms of what we want our viewers to know? Does it change anything that now that people say, oh, it's here, it's finally in our hometown, in our home community? Does that change anything about our behaviors or what we should be doing?
We've been talking for a while now about the importance of social distancing, social isolation, good hand hygiene, covering your cough, washing your hands well, not touching your face. I really hope that this is a message, even though we knew that this was going to happen and predicted it. It is here now in our community. We have proof that it's here in our communities. So I would just ask everyone to please take care of each other and those that are elderly or frail with chronic medical problems in our community by honoring those dictates of staying close to home and not in crowds and washing your hands.
And last question for me, if you can just tell us the difference maybe between the social distancing and complete isolation or complete quarantine. Yeah. Is there a difference in terms of whether people should be afraid to even go out their front doors?
So quarantine we would really reserve for those people that know they are positive for COVID-19 or those excuse me, who are frail or ill or elderly who have chronic medical problems. The social distancing, we would say for other people, so that's really sticking close to home, not going to crowded places. You can still go shopping, you can go visit your physician, but don't go hang out with your friends or go to big parties or large crowded areas.
Anything else you'd like us to know tonight?
Nope, we're just going to do our best to take care of all of those in our community and work together and be as transparent as we can as we go through this together.
Okay. Thank you very much for your time. I
You're
appreciate
welcome.
it. And that's Dr. Christine Nefsey, the Chief Medical Officer here at Munson Healthcare in Traverse City. That's going to do it for us live in Traverse City. I'm Bill Freilich for 9 and 10 News.
Thank you, Bill, with that important information, as now there are confirmed cases at Munson Hospitals in Traverse City and Gaylord. And speaking of the social distancing, that's why I'm standing here. Courtney's at the desk. We are separated here in the studio just to conform to that social distancing.